Joining me now is Dr. Samuel Eldebring from, I'm going to try it, Linköping University.
Oh, excellent.
Thank you, Sweden. Well, congratulations on your award.
Thank you.
Why don't you tell us a little bit about your simulation program and what got you to the award?
Yeah, so the simulation program, as it's spelled in the Aspire application, was a bit of challenging for us because we don't consider it as a special program. So when we think of using simulation in education, it's just one among several tools in a toolbox. So we had to sort of narrow, okay, if we're going to describe our simulation activities or program, we need to take quite a big scope and describe how we systematically develop activities, how we integrate them into the study programs that we have, etc., etc. So when it comes to full-scale simulation, because the Aspire category of simulation is quite widely described. So in simulation we incorporate virtual patients, simulated patients, full-scale simulation. But when it comes to full-scale simulation, we've used that since 2008 in Linköping, which was quite early on in the country of Sweden. And now it's been growing since then. And one of our most interesting activities in that respect is when we bring medical students and nursing students together, last year students, into a full day of simulation in acute scenarios. And that is very relevant and interesting activities at our center.
It's really nice to hear at the undergraduate level that interprofessional simulation team-based teaching, because you're teaching them what's going to happen when they get into the real world.
Yes.
Are you getting really good feedback from the students?
Yes, we're getting feedback that they perceive the scenarios as very relevant and authentic. And we're getting constant feedback that they want more simulation, and they want simulation earlier on in their education, because most of our full-scale simulation activities takes part in the later phases of their education. We also get feedback from this simulation day that they are quite stressed, anxious, and this tells us this is not a game for them. They take the simulation activities very seriously, and they go into the simulation activities with full focus on what's going on, the patient, their peers, and afterwards we go to a different room, talk about it with feedback from their peer students and from the instructors, and then discuss what went on, that was good in there, and how could we be doing things differently, and they bring things that they continue to bring in their future reflections.
Yeah. I want to focus on that stress issue, because I think that's really important, because if they have the stress and they learn to deal with the stress in the simulated environment, it may well help them when they get into the practice environment.
That's what we hope for, to train them. And during this day that I just talked about, they repeatedly meet different scenarios. So some, even though the patient scenario is different, some things are the same, and their teammates are the same. So they bring experiences from their former scenario to the next one, and hopefully into a future practice, of course.
I want to go back to something else you were talking about before, because I found it really interesting, the way you view simulation. It's not that freestanding thing, but it's incorporated into all of the aspects of training.
Yes.
I think that's a really good view. What advice would you give other programs who may not take that same view?
Yeah, there are a lot of things to discuss about that, but one advice is to collaborate very closely with educators within their study programs. Not all of the faculties around in Sweden and around the world are working as closely as we do with different study programs. We have 7 undergraduate study programs at our facility, and our simulation center, so to speak, serves all of them. So, but my advice, back to your question, is collaborate closely with the study programs, their teacher and their curriculum development, so that the activities match hand in hand with their aims and their course aim, so that when they send their students to us, they are prepared, they know what's going on, and it's
one part in a harmony of educational activities. So they are prepared in cognitive knowledge, they come to us and get hands-on experience, and later on in their study program they follow up and build on that experience.
Well, that harmony is a good word because it's that cohesion between the different people, so it sounds like a really great program.
Yeah, we, as you're probably aware of, there's a concept of constructive alignment, and that's what we constantly come back to, and also relating to this when we organize our simulation activities in conjunction with the study programs, teachers and course developers.
And when you bring the award back home, what do you think the reaction is going to be from the team and from everybody, the wide team, everybody involved?
Yeah, it means a recognition. I'm working with simulation, that's very close to me. For other teaching colleagues, simulation is more in the periphery, so this award makes it easier for me and my colleagues to discuss on a serious level this fantastic tool with simulation, so that we can build on a higher level and reach even farther when it comes to students learning and become future professionals.
Well, congratulations again, fantastic work,
Thank
and
you.
I hope it continues.